Hello my dear students, today we are going to see about the causes and the risk factors, okay, now related to illness, causes and risk factors which are related to illness. So let us understand first what are causes and what are risk factors, okay. Causes are nothing but is a reason for a condition or that which produces an effect. Causes are also called as etiology, okay. Now, as you go ahead in your second year, medical surgical nursing, when you start studying, you will understand that every disease condition has a first cause. Okay, what do you mean by cause? Cause is nothing but the main reason why the person is suffering from this particular disease. For example, the most common disease which is going on now is a COVID. So, COVID is caused by whom? By coronavirus, right? So, coronavirus is the first main cause. Are you understanding? Okay, so it is what? Cause is nothing but the main reason for a particular disease condition or illness, or it may also be said as that which produces an effect, some effect which is seen. So here in a medical terminology we can say cause is nothing but an etiology, is a reason for a disease condition. Okay, for example, if I say any other disease, for example, if there is an infection in the body, it can be related, like pneumonia, let me take pneumonia can be mainly because of some bacterial infection, right? It can be viral infection also. Okay, so this is what the main cause. What is the main cause? Main cause is nothing but the reason why a person is suffering with that particular disease or any illness. Clear enough? And now how to understand these causes in a better way? We are going to see some theories, and that is called as a concept of causation. There are many theories and many models which are describing causes, but here I have listed down few of it. Okay, so let us understand the first concept of causation. So it was very long back, people used to consider that a disease is caused only because of one particular microorganism, or it's called as a germ theory. Okay, so germ theory of disease. Germ theory was proposed by Louis Pasteur and Robert Koch. It postulates that human disease is caused by a microbe or a germ. And that's why the theory name came as a germ theory of disease. Now, according to this concept of causation, that a human being is going to have a disease or any illness mainly because of a germ entering into his body. Okay, you can see over here a disease agent is there, okay, or germ is there. He enters a man, okay, and then he causes a disease. That was the only concept at the very long back. Very long back, people had only this concept that if a person is becoming ill, or if the person is having some disease, it's only because some microorganism must have gone, or germ must have gone into his body, and then he is going to have a disease. But it's a very restricted concept. Yes or no? It's not because only that germ is entering into the body. There are many other factors, right? So, because of the failure of this particular theory, further theory came into picture. Okay, so which is specific for that disease, one must be able to isolate the microbe from the diseased human being. So, according to germ theory of disease, if that particular germ has gone into the person's body, and if we try to take a culture and not a culture, but if we try to bring out or take the blood sample, we can isolate that particular germ from his blood. Then only we can say he is suffering with that particular organism. Not only blood, also for example, for COVID also, no, we take a swab, okay, pharyngeal swab, oropharyngeal swab, we take with nose swab, and then we see whether that particular virus is there or not, and then we say yes, you are COVID positive. The same thing, they had this restricted concept. But if you know, a person getting a disease is not only related to the microorganism, is also related to the environment, it is also related to the human being's immunity. As you know, if a person's immunity is low, he will be prone, or he is at a risk to get a disease, right? So there are many other factors also. So germ theory of disease is very restricted. It only concentrates on a factor that if a person is getting a disease, it's only and only because that microorganism going into his body. Okay, this is about germ theory of disease. The next concept of causation is epidemiological triad. Okay, so epidemiological triad, there's nothing but a triangle which we always draw for epidemiological triad. It consists of three main concepts, that is agent, host and environment. Okay, now what is an agent? Agent which may be a pathogen or an unhealthy behavior. Most commonly we call an agent as a pathogen. For example, agent can be virus, fungi, bacteria, or any microorganism. Next, a host. Host is nothing but an individual, a person or a group of person or individual susceptible to get a disease. And environment. So there are three main concepts in epidemiological triad. According to epidemiology, a person is going to get disease when there is imbalance, when there is an imbalance of the host with the environment and the agent is already there. Okay, so this theory postulates that for disease to occur, the agent must interact with a susceptible host in presence of a, this is a very important word, conducive environment. Now, just an example, if I am sitting with a person who is COVID positive, okay, I am sitting with a person who is COVID positive, I am not wearing my mask properly, I am not using any PPE kit, I am just going and talking with him nicely, and then too I am not maintaining a distance, I am sitting almost at a only 1 meter distance, or that is what, I am sitting very nearby, I am not maintaining distance. What will happen? What I am doing is, first of all, I am not wearing my mask properly. If my immunity is low, I am at a risk of getting it, right? And the second thing, I have not maintained a proper distance. So environment is conducive that I can get COVID because of it. Are you understanding this? So what epidemiological triad is saying is that when the agent is there in the environment, okay, the host is susceptible. A host is not taking precaution. Host is having a low immunity. Host means an individual, okay, a person is having a low immunity, or he may be suffering with some disease like chronic disease. People are at a risk of getting it. Children are at a risk of getting disease because their immunity is low. Are you understand? And the environment is conducive. Environment is also helping that you can get a particular disease. Then we say it as you are going to suffer a particular disease. Again, let me give you another example. For example, there is a patient who is TB positive, okay, and TB positive patient is sitting near me. Now I am wearing my mask properly, okay, I am maintaining a distance, okay, and then talking with my patient. So I am at a less risk because my immunity is also good, okay, my immunity is strong, I don't have any chronic illnesses, my health, I am healthy, okay, then the chance for me to get a disease is less. Even if the environment is conducive, here because of my strong immunity, I am not going to get the disease. Are you understanding? So epidemiological triad concentrates on this three parameter, okay, and whenever there is some problem in the environment, the environment is conducive, the human host is not much of the susceptible or susceptible enough, then the agent can come and cause you disease. Clear enough? Yes, this is epidemiological triad, okay. Next concept of causation is epidemiological tetrad. What do you mean by tetrad? Is that triad means 3, tetrad means 4. Now here the fourth factor is nothing but the time. Now what do you mean by time? In epidemiological tetrad theory, along with the agents, susceptible host and conducive environment, the fourth factor is time is added as capable of causing disease. Now, for example, I said you that I am going and talking with a TB patient. I am just going and talking with him for maybe 1 minute. 1 minute is not a time period where it can cause me some disease. But if I am sitting with him and the environment also, just an example, if I am sitting, yes, I am wearing my mask and there is no proper ventilation, okay, there is no proper ventilation, means cross ventilation nahi hai, the room is packed and I am sitting without mask, I am sitting near him. So what will happen? The environment is conducive for me to get the disease, right? And I am sitting for almost 5 hours with him. Now this is a very long period. So time also plays a very important factor for me to get a disease or not to get a disease. Understood? Now why we are seeing all this thing? How can a person can cause or how a person can suffer from a disease? We are seeing that. Understood? Yes, that is epidemiological tetrad. Next concept is very important, multifactorial theory. What do you mean multifactorial? That a person can can have or can develop a particular disease or illness because of many factors. It's not just one factor like we have seen in the germ theory, only the microorganism, not in an epidemiological triad where we have seen environment playing an important role, but there can be many factors. So that is what multifactorial. That is right. Okay, so when knowledge about disease increased, one theory was not able to explain the causation of all disease. So this led to multifactorial theory to find rational or the reason or proper reason why the person is suffering with a disease. So there were many such, although many diseases are infectious, what are the different other causative factors which were found out? First is genetic. This is so true. You know, if for example, if my parents are suffering, my father is suffering with diabetes, then I am at a prone or I am at a risk for developing diabetes. Okay, or I can say that I can also suffer and if I am not maintaining a good healthy habit or I am not having a good lifestyle. Are you understand? So genetic was another factor which was found out. Now we are seeing multifactorial. It's not because a particular organism coming into my body, but what can cause me a disease? One is genetic. Okay, we are going to see genetic in our risk factor also, which is most commonly written in risk factor. Next is nutritional. It's very important. If I am not eating healthy food, I am eating all junk food, I am eating lot of fatty food stuff, or I am eating lot of oily food stuff. So I am at a risk of increasing my cholesterol and then causing further diseases, most commonly cardiovascular. Are you understanding? So it's very important that we should take care of our health. So that is nutrition. So nutrition also plays a role for us to lead us to a particular disease. Next is immunological. Immunological, again, our immunity going down. Okay, again immunity going down, you can understand if we are suffering from some diseases like chronic diseases, okay, or some communicable diseases, okay, or some immunocompromised status like HIV and all. Next is metabolic and cytological factors. Metabolic factors means related to our metabolic system. Our metabolic system, how it is working, if you are suffering from thyroid related problems. Are you understanding? So this is all the different factors which can lead to a person suffering from a disease, or it can be a causative factor. Are you understanding? So this is about multifactorial theory. And the next theory is holistic. This is very important. I know I said the first one also important, but this is saying the real fact about our causation of the disease, or the main thing is holistic. Is not, for example, if you see a human being, he's looking healthy, that doesn't mean he is mentally healthy also. If you remember the definition of health, health is a state of complete physical, mental and social well-being. So mental plays a very important role. It's not just physically healthy, we should be mentally healthy also, right? Yes, so it is holistic. So whenever we are seeing the cause of disease, we should never concentrate only on the physical parameter. The mental health, the social well-being of the person also has to be taken into the account. Okay, so according to holistic philosophy, the human being is unified, whole, consisting of, so as a human being, we have this body, we have this mind, and we have the spirit, the soul. This three things, we are made of this three main thing, and we need to take care not only of our body, we have to take care of our mind. Now how can we take care of our mind? By giving positive thoughts to ourselves. We have to give positive thoughts to ourselves. We have to think positive. Are you understanding? And how we are going to take care of our soul? By being, I can give you a few examples that if you want to develop your soul, have a spiritual contact with your main God, whoever you believe, okay? Trust in the life process and have a gratitude. You should have gratitude towards whatever you are doing. Okay, this is just few examples I gave you. When a disturbance arises in any one component, the other components suffer and the individual as a whole suffers. Now just this line I can explain you with one example. If your friend, your best friend is not talking to you, वो आपसे बात नहीं कर रहा है, आपको अच्छा लगेगा? Are you going to feel good? No. What happens? You feel stressed out. Why he is not talking with me? And why he is behaving like this? And that stress sometimes leads you to, मुझे खाना नहीं खाना. I don't want to eat. I don't feel like sleeping. If that is to such an extent, okay, where the person is not at all looking at your face and you are getting disturbed, why he is this is what you are mentally disturbed because of his behavior or his or her behavior. Okay, so when you get disturbed, what happens? you will not eat, you won't sleep. So your mind or your mental thoughts, your thoughts are disturbing your physical thing. So this is what holistic model is saying, that is not just a physical problem affecting us, but the thoughts, the processes which is going can affect our physical body. Okay. So this is what, when a disturbance arises in any one component, the whole thing gets disturbed. So one example is written, perceived stress. Now what you mean by perceived stress? Stress, you know, right? Perceived means आप सोच रहे हो ऐसा होगा. That is perceived. For example, if someone tells you that a lion is going to come, okay, and you think, if you are sitting in a jungle with your friends and if someone says you, then you can perceive it. Yes, lion is going to come because I am sitting in a jungle, okay. But if someone tells you at your home, आपके घर पे lion आने वाला है, will you take it as a stress? Never, because you know in a city there is no lion who is going to come. Perceived stress means what, you realize, yes, this will happen, and you then become stressful, right? That is called as perceived stress. Stimulates the hypothalamus pituitary axis and promotes the release of cortisol and catecholamine and impairs the immune system. Can you see this? When we are stressful, our immune system gets disturbed. Okay, so our immune system goes down. So what we need to do? We should never take stress, right? We should never take stress about anything. Love the life what you have, okay? Feel free to ask for help, okay? And never think that other person is always thinking negative about you. Never, it never happens. You sometimes develop such thoughts, okay? Have positive thoughts about yourself. Think positive about others also. Okay, so the simple tips which I want to give you, because you need to love yourself and the life which you have got. Okay, so this is a holistic model of health which talks about holistic development of a human being, so that we can understand that the causation of disease not only because of some particular germ of environment, but it can be related to our thoughts also. Clear enough? So this is about concept of causation. Very rarely asked in your exam, but you should be aware enough what is cause and what are the concept of causation. Okay. Next we move on to the risk factors. Risk, you know, we take risks sometimes, right? So what are the risk factors which can lead to a particular illness? Okay. So risk factor is any situation, habit or other variable such as social, environmental, physiological, psychological, developmental or intellectual that increases the vulnerability, that is the chance of an individual or group to an illness or accident. Simple example, if I am not eating, or if I am eating, let me take it, if I am eating lot of fatty food stuff, I'm nicely eating butter, oil, I'm nicely putting oil, butter in everything what I am eating at this age, if I'm continuing in this for many years, let me take it 2-3 years, I am at a risk of become obese. Yes or no? I'll become obese enough. Then I am also risk for getting cardiovascular diseases. These are nothing but the risk factors. Okay, risk factors are nothing but a situation, it can be a habit, it can be that we develop and cause problem to ourselves. And as a nurse, we need to identify in our patient so that we can promote his health. Okay, so that we can promote our patient or client's health. Clear enough? So risk factors is nothing but a situation, habit or other variables which can be social. Social, how it can be, for example, you see your friends smoking and you start smoking with them, but you don't understand smoking is a risk factor for lung cancer. Are you understanding? So this is what social, environmental, physiological, psychological. What you think, this is very important. Psychological means if you are having negative thoughts, it can affect your whole body. Negative thought decreases your confidence, decreases your self-esteem. Are you about yourself if you are having? Okay, so what you need to have? Positive thoughts. Positive thoughts about yourself which will increase your confidence and self-esteem. Developmental or intellectual. So these are the different risk factors. We'll be seeing few examples also. An example will be risk factors for falls. Now risk factor for fall, for whom it can be, such as impaired gait. Impaired gait का मतलब है जिनको चलने में तकलीफ है. Impaired gait. The person is at a risk for fall. Reduced vision, जिसको दिखाई कम दे रहा है, he will be or she will be at a risk for fall. Fall means गिरना. And lowered extremity weakness, those who are having weakness in the lower extremity can be at a risk for fall. The same thing commonly we do in our hospital when a patient has been bedridden, we always take care that he should not fall from the bed. So what we do, we put up the side rails. Side rails are nothing but at the side of the bed there are rails which we raise it up so that he doesn't fall. The second common thing, if a patient is bedridden, we think that he is risk for pressure ulcer, okay, bed sores, because if he is lying down for a longer period of time, there's a friction between his skin and the bed linen. It can lead to first redness and then sore. As we have mouth ulcers, the same, there is a pressure ulcers which happens for the patient. Okay, so it's very important for the nurse that she changes the position of the patient every 2 hourly, and every 4 hourly she gives back care. Risk, I'm talking about risk now. A patient who is admitted with diabetes, I know he is at a risk for developing complications. This is risk. Are you understanding what is risk? So risk is nothing but some habit or situation which can lead into, or which can cause, or which can be causing vulnerability for a person to develop a disease or illness. Okay, and as a nurse, it's our responsibility to protect our patient from going into that illness. Okay. So the presence of risk factors does not mean that the presence of risk factor does not mean that a disease will develop, but risk factor increase the chance, that's very important, that the individual will experience a particular disease or dysfunction. Now what do you mean by this, the presence of risk? Now when I'm saying that a person, let me take it one risk factor as genetic. Now genetic means hereditary. Hereditary means if my parents are suffering with diabetes or hypertension, then I am at a risk for developing diabetes or hypertension. I am at a risk means मेरा chance ज़्यादा है. Okay, now how can I prevent myself from getting this particular diseases? I have to have a healthy lifestyle. I have to at least do exercise. I have to reduce my stress. I have to not only just walk. I have to my cycling, all such things. When I do, I have to eat properly. I have to stop eating all oily food stuff, because I know that my parents are suffering. I am at a risk. Are you understanding? But that doesn't mean that risk is present. That doesn't mean that you are going to get it. That you are going to suffer. It means that the chances are there. Chance है. Heredity का मतलब क्या है? It will be transferred to me through genes. But मेरे genes में है, but मुझे अब तक हुआ नहीं है. I am not suffering, but I am at a chance of developing if I don't maintain a proper lifestyle. Clear enough? Yes. So it's very important that it's very important for us to educate our patient. The patient doesn't know that he is at a risk, and when you tell him, then he understands it. So it's our responsibility to prevent or protect our patient from going into an illness. Okay. Next are types of risk factors. Now here you can just write it down, types of risk factor, by just listing down the points what I'm talking about here, or you can just write it down, modifiable risk factors and non-modifiable risk factors. Let us understand what you mean by modifiable. Modifiable का मतलब हम कुछ change कर सकते हैं. We can change something. Now modifiable means we can change. Now here you can see the first risk factor which I have mentioned, lifestyle. If a person who is sitting, let me give you an example where he's in 38 years of age, he's always sitting on his chair in front of the computer every time. Okay, and he's not walking also, he's not doing any exercises. His parents are suffering with diabetes, and he is at a risk of developing diabetes. He is also having nicely very sweet products, बहुत sweet खाना खा रहे हैं. Now I know that he is at a risk for getting diabetes. So what is my responsibility? To tell him to change his lifestyle. Can a lifestyle be changed? Yes. You can change your unhealthy lifestyle or unhealthy behavior to healthy behavior. So this is called as modifiable. Modifiable means हम कुछ change कर सकते हैं. Okay, we can bring out some change. If that is possible, then that is called as modifiable risk factor. Now lifestyle, as I told you, most commonly in our surrounding also we see people are living a sedentary lifestyle. What do you mean sedentary lifestyle? No exercises, eating unhealthy, eating always junk foods, okay, or eating more about oily foods or more about fatty foodstuffs, or not doing any meditation, not having control of all the stress which he is suffering. All these things, this is a lifestyle which has been made or we have created for ourselves, is going to lead us to some or the other disease. So it's very important that we change our lifestyle. How can we change? At least exercise for half an hour, or at least walk for a half an hour. At least give time for yourself to pray or to have alone time with yourself, because we are never taking our time for ourselves, right? Read some good books so that you are stress relieved. Do what you love to do. Keep your workspace different and your personal space different. Don't merge it together. These are the few tips which is very important to have a healthy lifestyle. Are you understanding? So lifestyle is one. Next is smoking and alcohol consumption. As you know, smoking is not only the factor which can lead to lung problem, but smoking can lead to many other problems. There are many cancers which are related to smoking also. Okay. Now in smoking also two main things is there: active smoking and passive smoking. What do you mean by active smoking? Active smoking means मैं smoke कर रही हूँ and the person who is next to me, he is also going to get that smoke smell. So I am an active smoker. Passive smoker means what? I am smoking and the next person who is sitting next to me, he is getting that smoke. So he is called as a passive smoker. I am the active smoker. Okay, so smoking doesn't mean कि मैं तो smoke नहीं कर रही, but then too I am going to get a disease. It's not like that. If you are with someone who is smoking and you are sitting next to the person and you are getting that particular smoke, then you are called as a passive smoker. Most commonly we see in family, the father is smoking, so the mother and the child can be an passive smoker because they get the smell of that smoke. Are you understanding? So smoking also causes, and we can stop smoking. Okay, we can stop smoking or quit smoking so that we can have a healthy lifestyle, okay, or healthy behavior. Next is alcohol. Alcohol also causes many liver diseases. Okay, so and even GI problems also, gastrointestinal. So very important that person should stop drinking alcohol. Okay. Next is obesity. You know, obese person are at a risk of developing cardiovascular diseases. They are at a risk of developing diabetes, hypertension. So it's very important that they control their weight. They bring their weight to a normal BMI. Okay. The next is stress. Stress is the biggest risk factor. Stress needs to be handled properly. If you are not controlling, you are not having control of your own stress, it can lead to many diseases. Yes, there are mental illnesses. Commonly we have seen depression. That's a mental illness. Depression, people going in depression because of stress. Are you understanding? So it's very important that we take life positively and have a control of the stress which we are having. Okay, and have a positive attitude towards it. Clear enough? So all these factors which we have just now saw can be modified, can be changed. Now let us see the next factor. As we said, there are two factors or two risk factors types: modifiable and non-modifiable. Let us see what are non-modifiable risk factors. What do you mean by non-modifiable? Non-modifiable change नहीं कर सकते. Can I say the first non-modifiable risk factor is age? Can I say चलो ये बटन दबा के मुझे छोटा कर दो? Can I go back? Can I become small? Can I say I want to grow 60 years? I don't want to go to 60 years. But can I say, can I become small? I want to become again 10-year-old. It's not possible. There's no such button anywhere that I can press and go back. Right? That is called as non-modifiable risk factor. Okay. So age cannot be modified. Whatever is the age, you have to accept and try to do something or change your lifestyle so that you have a proper, you don't develop any particular disease. Okay. Now for in age, I can give you an example, like males are more prone to get heart attacks at an early age as compared to females, because female in the early age, they have their hormones to prevent or protect them from any cardiovascular diseases. So this is the age factor. Are you understanding? The next is hereditary. Hereditary का मतलब क्या है? That if my parents are like illness, hereditary, there are many hereditary illness like diabetes, hypertension. If my parents are suffering, they are giving me through in the genes. Genes से मुझे दे रहे हैं. So can I say कि नहीं ये genes निकाल दो मेरे body से? Can I remove that? It's not possible, ना? So hereditary also I can't change my parents. That is God what has given me, right? But I can have proper control on my lifestyle so that I don't suffer a particular disease or illness, right? Next is gender. Now here, that's what I was saying about male and female. So most commonly gender, males are prone to this disease, female are prone to this. We can't change, na? But we can have a proper control of different parameters so that we don't develop particular disease. Okay, are you understanding? So age is there. Now age may, again I can say that children are more prone to get which disease? Respiratory disorders, because their immunity is low. The same thing, old age are prone to get more of the respiratory disorders, because again immunity is low. Are you understand? So this is what, these three parameters cannot be changed. They are fixed. You can't do anything, but you can bring about some change in your modifiable risk factors. Understood? So this is non-modifiable risk factors. Now there is one more risk factor, which is an environment. Environment means what? Environment can be written in your non-modifiable also, in your modifiable also. Like for example, if a person is staying in an environment where there is lot of pollution, so he is at a risk for getting respiratory disorder. So he can change his environment by going to some other place, but that is not possible for him. Then we can't change the environment, we can't remove all the pollutant from the air. No? That's why I've not mentioned here, but you can also write environment as one of the risk factors. Okay, if you don't want to write the types, you can just list down all the risk factors and explain them. Okay, hope so you understood what is a risk factor. Next, what we are studying in risk factor is a risk factor modification. Identifying risk factor is the first step. So very important for us to identify that this person is risk for developing this. This you can nicely identify when you see your patient, talk to your client, talk to your patient. Okay, first step in health promotion, wellness education, illness. This is identifying risk factors, the first step in what? Health promotion. If you remember, we had studied in levels of prevention, right? So health promotion, wellness education, so that I bring my patient in a proper health, and illness prevention. Risk factor modification are aimed at cessation. Cessation means total stoppage of a health damaging behavior. We are always forming behaviors which damage our health. Okay, just you can see tobacco use, alcohol misuse, drinking a lot of alcohol, tobacco, eating tobacco. You have seen that, no? There's so many oral cancer. There are many diseases which are causing because of all such use. But then too, people don't change their behavior. Changing the behavior is very important step. If a person wants to be healthy, then he will take a step. Are you understanding? So here we are helping our patient for it. Or adoption of a healthy behavior. We have to stop all the unhealthy behavior and adopt. मतलब लेना है अच्छा behavior. What are the good behavior? Exercise, pray, or eat healthy food. All these are healthy behaviors, and this you are going to educate your patient about. Okay. Next, and the last thing in this is nothing but changing health behavior. Now, what do you mean by changing health behavior? Now, after we have known that my patient is going to have a risk of developing an illness, I have to think what all change he can bring about. Okay, so understanding the process of changing behavior will help you to support difficult, this is very important, huh? Difficult health behavior. Difficult means where the person, for example, if a person can't change, it's very difficult for everyone to change into something different. Means if a person is having a normal routine, it becomes very difficult for the person to change it into something new. Okay, so it requires small step. Now, for example, you are just seeing a person, you are seeing a client who's sitting always in front of the computer but not doing exercise. You have to tell them just start at least for 5 minutes, then increase to 10 minutes, then 15 minutes. Because if you tell him रोज जाके 1 घंटा walk कीजिए, he will never do it because he has never done it in his life. Okay, so one thing which is not done any time, it's very difficult. So you can tell them to slowly start and then increase the time period. That will be easy, other than telling him directly go for 1 hour walk. The second thing also, if a person is smoking for almost 20 years and you abhi band kar do, very difficult for him. You tell him to reduce the number of cigarettes per day. Now he must be smoking per day 5 cigarettes. May tell him to reduce it to 4, 3, then slowly 1, and then stop, because it's a habit. Habit cannot be stopped in such a way. Are you understanding? So it's our responsibility to guide them. So it is believed that change involves movement through a series of stages. According to Di Clement and Prokasha, describes the stages of change in a trans-theoretical model of change. Now we are just seeing, now nobody is going to ask you, but you should aware enough about the stages. Once you know about the stages, it will help you to help your patient. Okay, so let us see this change model. So little point I have written. So this stage ranges from, the first stage is pre-contemplation. What do you mean by this? No intention to change. where the person doesn't want to change at all. That is for everyone will be at this stage. Change is very difficult. Okay. The second thing is considering a change within the next 6 months. Now he then thinking, chalo करके देखते हैं क्या होता है. That was contemplation, where he will be thinking about, I will bring about some change. Okay, so considering a change within the next 6 months, that is contemplation. Next is making small changes. That is, remember, change can't be brought just within 1 hour, or you're just giving हाँ अभी से full change नहीं होता. It's little by little we start. So that is called making small changes. Means you told him to walk, he will be walking for 10 minutes, 15 minutes, 20 minutes. That is called as preparation. That is a preparation phase where you've just started small changes. Next is actively engaging in strategies to change. Now actively, now you just told him and he one day used to walk for 15 minutes, next day nahi jata tha, next day always 15-20 minutes. Now he realized that walking makes me feel better. He feels that अरे वाह बहुत अच्छा लग रहा है चलने से. So he will do what? He will bring into his behavior. He will start doing it for regularly half an hour. Okay, so that is what? Actively engaging in the strategies and bringing it into action. And the next is maintaining. This is very important. Once you start something, you have to maintain it. Maintain करना पड़ेगा ना. Otherwise, I'm not telling him to walk just for one day. You have to do it every day. So once he started walking every day for 1 month, he felt really good. Now he's saying, I am going to walk every day now. And that is called maintenance behavior. Now here is our responsibility to bring our patient at the maintenance behavior as much as possible, because it's only for his betterment, so that he has a good health or illness is been prevented. Clear enough? And why I have brought this? Because here as a nurse we have to work on our patient. Hope so you understood what are causes and risk factors. And risk factor, very important, is how you're going to bring about a change in your patient. Okay. Thank you.